Hello, everyone. I'm Dr. William, an internal medicine physician. Today, we're going to dive into a crucial, potentially life-saving, and admittedly contentious discussion about three medical tests that doctors frequently present as mandatory once you reach 70. However, a growing body of medical evidence suggests these tests might actually cause more harm than good for healthy older adults. I believe it's essential to shed light on this vital medical information, supported by scientific evidence that the medical establishment often avoids discussing openly due to the billions in revenue these tests generate. Understanding what the research truly indicates about screening tests for seniors over 70 allows us not only to sidestep unnecessary procedures, but also to prevent serious complications and instead focus on interventions that genuinely enhance quality of life and promote longevity. So, welcome back to this platform where patient-centered care takes precedence over profit-driven protocols and where evidence-based approaches replace automatic testing that could be detrimental. Whether you're nearing 70, have already passed it, or are caring for elderly parents, the insights shared today could literally save your life or the life of someone you cherish. Here's the uncomfortable truth I've observed throughout my 28 years practicing geriatric medicine. Doctors routinely order three specific tests for patients over 70, asserting their necessity for health maintenance. Yet major medical organizations have quietly updated their recommendations, acknowledging that these tests often lead to overdiagnosis, overtreatment, and severe complications in elderly patients who might have enjoyed longer, healthier lives had they never undergone them. Let's address a scenario I constantly encounter in my practice, a situation that genuinely saddens me because I foresee the impending harm. The situation typically unfolds like this. Doctor, I'm 73. I feel fantastic, I'm active, and I have no symptoms. But my doctor insists I need a colonoscopy, aggressive cancer screening, and stress testing because they're mandatory at my age. However, I've heard stories of seniors who experience complications from these procedures. I'm confused because I feel perfectly fine. Do I truly need these tests, or is there something my doctor isn't fully disclosing about the risks versus benefits at my age? This question frequently comes from healthy seniors who instinctively feel something is amiss with aggressive testing when they're otherwise well. It arises in consultations where families seek to protect their elderly loved ones from unnecessary medical interventions and reflects a growing awareness that more medical care isn't always superior, especially after 70. I urge you to stay for this complete medical revelation because by the end, you'll possess information that can safeguard you from procedures that medical evidence increasingly indicates cause more harm than benefit in healthy seniors, potentially adding years of quality life by helping you avoid complications from tests you never truly needed. Now, let's begin with a medical reality that few doctors honestly discuss with their elderly patients. Medical screening tests are designed for populations where the benefits clearly outweigh the risks. However, this calculation shifts dramatically after age 70 because your life expectancy, the natural progression rate of diseases, and your body's capacity to tolerate procedures all undergo fundamental changes. As with all aspects of geriatric medicine, a nuanced understanding of risks, benefits, and individual circumstances is absolutely critical. Generic protocols developed for 50-year-olds are often actively detrimental when applied to healthy 75-year-olds. Yet most doctors continue to order these tests automatically without candid discussions about whether they will genuinely help you live longer or better. So let's start with the fundamental medical principles. What are these three tests that are routinely pushed as mandatory after 70? Why does the medical evidence increasingly challenge their value in healthy seniors? What are the actual risks that doctors often minimize or overlook? And most importantly, how can you have an informed conversation with your doctor about whether these tests are genuinely necessary for your specific situation, or if declining them is, in fact, the healthier choice? Let's begin with the 3 mandatory tests that I believe most healthy seniors over 70 should seriously consider declining. Mandatory test number 1, routine colonoscopy screening after age 75. This particular test is responsible for the most complications in elderly patients while offering minimal benefit. The U.S. Preventive Services Task Force now explicitly advises against routine colonoscopy screening after age 75 for individuals who have had normal previous screenings. So why do doctors continue to push it? Colonoscopies are extremely profitable. Each procedure generates between $3,000 and $5,000 in revenue for the medical system. Gastroenterologists, therefore, have strong financial incentives to continue screening elderly patients, even when medical evidence suggests they shouldn't. The hidden risks they often don't disclose. After age 70, your risk of serious complications from a colonoscopy increases dramatically. Bowel perforation occurs in 1 out of 300 procedures for seniors, compared to 1 in 1,000 for younger individuals, often necessitating emergency surgery. Cardiovascular complications stemming from sedation also increase significantly. The bowel preparation itself can lead to dangerous dehydration and electrolyte imbalances, which can trigger heart problems or falls. What the research truly reveals: a landmark study published in JAMA Internal Medicine tracked 50,000 seniors over age 75 for a decade. Those who continued routine colonoscopy screening showed no improvement in colon cancer mortality compared to those who stopped screening, but they experienced significantly higher rates of hospitalization due to complications from the procedures themselves. Here's the medical reality: colon cancer is slow growing. If you are 75 and had a normal colonoscopy at 65, any polyps that develop would typically take 10 to 15 years to evolve into dangerous cancer. Statistically, you are much more likely to die from heart disease, stroke, or other causes before such a slow-growing polyp ever threatens your life. Meanwhile, the colonoscopy procedure itself carries immediate, tangible risks of serious complications. The exception: if you are experiencing symptoms such as bleeding, significant changes in bowel habits, or unexplained weight loss, then a diagnostic colonoscopy may be appropriate. However, routine screening when you feel fine is what the evidence increasingly argues against after 75. Mandatory test number 2, aggressive prostate cancer screening with PSA tests after age 70. This is perhaps the most controversial screening test because we now have definitive evidence that it leads to massive overdiagnosis and overtreatment of cancers that would never have caused problems. Why doctors still advocate for it? PSA testing is quick, easy, and generates substantial follow-up revenue through biopsies, surgeries, and radiation treatments. It has become so routine that many doctors order it automatically without discussing whether it is actually beneficial. The hidden truth about prostate cancer: most men over 70 have some prostate cancer cells. Autopsy studies indicate that 60 to 70% of men who died from other causes had prostate cancer they were unaware of because it was growing so slowly that it never caused symptoms. These are cancers that would never have threatened their lives. What the research really shows: the European randomized study of screening for prostate cancer followed 162,000 men for 13 years. For men over 70, PSA screening did not reduce deaths from prostate cancer, but it did lead to massive increases in biopsies, surgeries, and radiation treatments, all with serious side effects, including incontinence and impotence. Here's what they often don't tell you: when you get a PSA test after 70 and it's elevated, you'll likely be pressured into a prostate biopsy. That biopsy carries a 2 to 3% risk of life-threatening infection, a risk that is much higher in elderly men. If the biopsy detects cancer, which it often will, given how common prostate cancer is, you'll be pressured into treatment, even though the cancer would likely never have threatened your life. The devastating consequences. I've seen dozens of healthy 75-year-old men who felt great, underwent a PSA test, were diagnosed with cancer, had surgery or radiation, and ended up with permanent incontinence and sexual dysfunction, all to treat a cancer that would have never bothered them in their remaining 10 to 15 years of life. The medical consensus: the American Cancer Society, U.S. Preventive Services Task Force, and American Urological Association all now recommend against routine PSA screening after age 70 unless you have a strong family history or concerning symptoms. The third test: mandatory aggressive cardiac stress testing in asymptomatic seniors. This is the test doctors use to check your heart even when you experience no chest pain, shortness of breath, or other cardiac symptoms. It sounds prudent, but for healthy seniors, it often initiates a cascade of unnecessary interventions. Why doctors continue to push it? Stress tests frequently lead to highly profitable follow-up procedures, such as cardiac catheterizations, stents, and bypasses, which generate hundreds of thousands in revenue. Cardiologists, therefore, have strong financial incentives to identify problems that require intervention. The hidden dangers. Stress testing itself can trigger heart attacks in elderly patients, as the test literally pushes your heart to its maximum capacity. False positive results are extremely common. 40 to 50% of abnormal stress tests in seniors show nothing wrong when followed up with catheterization, leading to unnecessary invasive procedures with real risks. What the research truly shows: a study in the Journal of the American Medical Association Cardiology followed 10,000 seniors without cardiac symptoms. Those who underwent routine stress testing had no better cardiac outcomes than those who did not, but they experienced significantly higher rates of complications from the follow-up procedures that the stress tests initiated. The cascade of harm. Here's the typical scenario. You're 73, you feel perfectly fine, and you get a stress test just to check. It reveals something abnormal. You're then quickly moved to cardiac catheterization. They discover a 40% blockage that would never have caused problems. They insert a stent to be safe, and you end up on blood thinners for life with increased bleeding risks, all because of a screening test you never truly needed. The medical reality: if you're experiencing symptoms such as chest pain, shortness of breath, or unusual fatigue, then stress testing can be an appropriate diagnostic tool. However, screening healthy asymptomatic seniors leads to overdiagnosis of issues that don't require fixing and exposes you to serious procedural risks. Let me share a specific example that illustrates all three of these concerns. A patient named Margaret came to me at age 76. She was active, healthy, symptom-free, and felt great. Her previous doctor had scheduled her for a colonoscopy, PSA testing for her husband, and cardiac stress testing, labeling them all as mandatory preventive care. I reviewed the medical evidence with her and her husband. We discussed that at their age, with no symptoms and previous normal screenings, these tests were more likely to uncover issues that would lead to risky treatments rather than genuinely extending their healthy lives. They decided to decline all three tests, opting instead to focus on interventions that truly enhance healthy longevity after 70: daily walking, strength training twice weekly, a Mediterranean diet, social engagement, and managing their blood pressure and cholesterol with medications. 5 years later, at age 81, Margaret remains active, healthy, and thriving. Meanwhile, 3 of her friends who did undergo those mandatory tests experienced serious complications. One was hospitalized for colonoscopy perforation, another developed permanent incontinence, after prostate cancer treatment, and a third ended up on blood thinners after a stent he didn't need. This story is not unique. I've witnessed this pattern hundreds of times. Healthy seniors who decline aggressive screening often live longer, healthier lives than those who submit to every test doctors recommend. The evidence supporting the refusal of these tests in healthy seniors includes evidence number one. A comprehensive analysis published in JAMA found that for seniors over 75 with no symptoms and previous normal screenings, routine colonoscopy, PSA testing, and cardiac screening led to no improvement in mortality, but significant increases in procedure-related complications. Evidence number two. The Choosing Wisely campaign, supported by dozens of medical specialty societies, explicitly recommends against these screening tests in elderly patients without symptoms, categorizing them as examples of low-value care that waste resources and harm patients. Evidence number three. International comparisons reveal that countries with less aggressive screening of elderly patients, such as the UK, exhibit similar or even better health outcomes for seniors compared to the US, where aggressive screening is routine. Here are the crucial questions you should ask your doctor before agreeing to any screening test after 70. Question number one. Given my age and health status, what is the actual probability that this test will find something that will genuinely threaten my life in my remaining years? Doctors rarely provide this crucial context. Question number two. What are the specific risks of complications from this test and any follow-up procedures it might lead to? Insist that they give you concrete numbers, not vague reassurances. Question number three. What would we do differently based on the results? Would finding something actually alter my treatment in a way that improves my quality or length of life? Often, the answer is no. Question number four. What do the major medical organizations recommend about this screening test for people my age? Many doctors disregard updated guidelines that advise against screening. My medical recommendation for healthy seniors over 70: focus your energy and medical care on interventions that truly enhance healthy longevity. Exercise, nutrition, social connection, and medication management for known conditions, rather than searching for problems through aggressive screening that often creates more harm than benefit. This doesn't mean ignoring symptoms or refusing all medical care. It means being selective, informed, and prioritizing quality of life over the sheer quantity of medical interventions. The reality is that after 70, less aggressive medical care often leads to longer, healthier, and more comfortable lives than the test everything, treat everything approach that has become standard. Before we conclude, I want to address something important for seniors who are taking charge of their health by declining unnecessary tests, but want to ensure they are optimally supporting their bodies to maintain the health and vitality that makes refusing these tests the right choice. Maintaining optimal health naturally to enable you to avoid unnecessary medical interventions requires supporting your body's fundamental systems: cardiovascular health, immune function, energy levels, and overall vitality. That's why I recommend two natural support options that assist seniors in maintaining the robust health that renders aggressive screening unnecessary. For seniors seeking gentle support for cardiovascular and overall health, I recommend organic watermelon extract, which is rich in natural L-citrulline. It supports healthy blood pressure, naturally improves circulation, and helps maintain the cardiovascular health that makes aggressive cardiac testing unnecessary. However, if you're looking for comprehensive health optimization, not just cardiovascular support, but also enhanced immune function, increased energy levels, and the overall vitality that allows you to thrive without aggressive medical interventions, then I recommend the Senior Vitality Formula. It combines Icarian from horny goatweed for improved circulation and energy, Tonkat Ali for maintaining healthy hormone levels that support vitality, fenugreek for metabolic health and sustained energy, nettle root for prostate health and overall wellness, and concentrated L-citrulline for optimal cardiovascular function. Together, these ingredients support the robust health that empowers you to confidently decline unnecessary screening tests, knowing your body is functioning optimally through natural support rather than aggressive medical intervention. You'll find both options linked in the pinned comment and video description below. Take control of your medical care by refusing tests that harm more than they help, because healthy aging after 70 comes from supporting your body naturally and avoiding the cascade of complications that often follows aggressive screening. For persistent symptoms, please consult a professional.